Good evening. I'm Jennifer Regala, Director of Publications at the AUA. I'm joined tonight with Dr. Robert Siemens, the editor of the Journal of Urology. He's also professor and former chair of the Department of Urology at Queen's University and is director of the Center for Applied Urological Research. Also former editor of the Canadian Journal and current president of the Canadian Urological Association. So very busy. So we're really appreciative that Dr. Siemens is willing to join us. Also addressing the elephant in the room, this was meant to be a live session. We are now pre-recording it. There's just a lot going on in the publications department and in research right now. So the time just did not work out quite right, but all is not lost. We invite all of you today who are here joining us and anyone else that you'd like to bring along with you to our publications booth in the square at AUA 2024 in San Antonio. Still not too late to register. And you can join us Saturday, May 4th at 10 a.m. at the booth to meet with Dr. Siemens and get answers from him and have discussions on this very topic. So this evening, we're going to talk about bladder cancer, all things bladder cancer. Dr. Siemens, thanks for agreeing to be here. We thought it would be a really great approach to talk to the leader of our flagship journal and also know that bladder cancer is an area of expertise for you. So just wanted to ask you first up, what are you seeing in your own practice and in your own research? Would love to hear more about your thoughts on that.
Well, thanks for asking me, Jennifer. It's a real pleasure, especially to talk about bladder cancer. So much is going on in bladder cancer research right now, which is great to see. You may not know, but in the not too distant past, funding for bladder cancer research was amongst the lowest for any cancer site relative to patient cost and mortality. So it's really encouraging. For me personally, I focus mostly on bladder cancer clinically, but also in my research. So it's really encouraging to see so much effort and results over the last decade, but especially over the last few years. I'd say I'd start by highlighting probably one of the most recent important trials in advanced bladder cancer. Metastatic bladder cancer. And this is going to continue to change our paradigms in bladder cancer care, I think. This is EV302, is published just in March this year in New England Journal of Medicine. If I can explain it a little bit for our listeners, if they haven't heard, the standard of care for advanced bladder cancer, metastatic bladder cancer includes chemotherapy. As well as immuno-oncology, including PD-1, PD-L1 inhibitors. These immuno-oncology drugs are administered either as frontline, second line, or maintenance therapies. Now, despite some benefit, the modest benefit of these systemic therapies, this metastatic bladder cancer is very aggressive. Many of our patients also aren't candidates for chemotherapy. Immunotherapy has more acceptable side effects and is associated with a longer duration of response than chemo, but only a minority of patients have a durable response. Usually the overall survival is anywhere 10 to 14 months. So in March of this year in New England Journal, the EV302 study was published for those patients that were previously untreated with advanced disease. And this is with enfortumab. It's an antibody drug conjugate directed against an antigen Nectin-4, and it carries a payload of a drug that inhibits microtubular formation and leads to apoptosis. Anyways, this EV302 study showed a progression-free survival improvement of enfortumab and pembrolizumab combination over our standard chemo regimens. And really a significant difference, like 12 versus 6 months difference with much less adverse events. The overall survival difference was 16 months for our standard of care systemic chemotherapy versus about double that, 32 months. So this is incredible. It's a game changer for us. We've known this ADC, this antibody drug conjugate uh, treatment for bladder cancer has been significant over the last few years. We've had a few studies, but this is really a game changer, this combination therapy with nearly a doubling of overall survival with locally advanced and metastatic bladder cancer. It's also expanding the number of patients that we can actually treat because for the most part, many of our patients, elderly patients, were not able to tolerate prior standard chemotherapy. Now, this has been FDA approved as of December, so it's already out there in the US. It's in front of Health Canada right now as we speak. I'm from Canada. Funding is always an issue for us, but again, I think this is going to be a huge game changer for the treatment of advanced bladder cancer, and that's going to trickle down also to muscle invasive bladder cancer when we start thinking about neoadjuvant and adjuvant therapies.
It's exciting. Also, I'm going to go rogue. I did not tell you I was going to ask you this question, but just always thinking of our early career folks who are so passionate about getting involved in urology and getting involved in research and so forth. It just makes me think, what led you to become so interested in bladder cancer research? And I just know, how passionate you are about caring for your patients and everything that you do. Would love to just get a little editor-in-chief take on that.
A surprise question. Great. No, I mean, it's a good question though, because I mean, when I started out my practice, it really focused on prostate cancer. I mean, so common. We did a lot of immunotherapy work early on in my fellowship and then first few years. I think probably the thing that stimulated more thoughts in terms of clinical and basic science research was that bladder cancer was underfunded. It was sort of an orphaned cancer site, believe it or not, for such a long time. And I just recognized, many of us recognized how much work needs to go into it. So that was number one. Number two, I think, was that my mentor when I was in residency was Dr. Alvaro Morales, who was the first person to put BCG into a bladder here at Queen's University. So I think that pedigree and that interest in bladder cancer research and specifically immunotherapy was the impetus for me to sort of pivot from prostate cancer more to bladder cancer over the last 15 years or so.
That's really interesting. Thanks for taking my surprise question.
No problem.
So, Dr. Siemens, I know you're just back from EAU in Paris. You represented the Journal of Urology there. Thank you for doing that. And I know you had a chance to attend a lot of sessions. And also, I know it's very important, the sidebar conversations that happen at meetings like that. You met with a lot of other global leaders. Just curious to hear what the buzz was there, what you heard about bladder cancer at that meeting, anything that you can share with those of us at home who were not able to make it.
Yeah, Paris is great, number one. Number two, yeah, there was a lot of discussion around bladder sparing. So not having a cystectomy for muscle invasive bladder cancer, I think there was a fair amount of buzz there. And this is true for the last few years, looking specifically at chemoradiation for muscle invasive bladder cancer. A great comparative study from Alex Lotta from Toronto. It's published for the last 9 or 10 months, maybe, comparing 3 institutions' experience of chemoradiation compared to cystectomy for muscle invasive bladder cancer, and really showing some compelling observations about cancer-specific survival. At the EAU, there was a number of studies. There's one that I recall, a Japanese trial, sort of unique. Tanaka, I believe, was the first author, looking at a decision point after neoadjuvant chemotherapy. So getting neoadjuvant chemotherapy and then having a decision point about whether or not to go on with radical cystectomy versus other bladder sparing protocols. And this one, it was very unique group of patients with unifocal muscle invasive bladder cancer. It was very, very select patients, but the decision point was to go ahead for those with a good clinical response, a complete response after chemotherapy, to go to a partial cystectomy. So just taking out the lesion, the unifocal lesion, versus radical cystectomy. And in their trial, 85% or so spared their bladder. So it was just an example of a paradigm that I think we're seeing in terms of talking about either surveillance or bladder sparing after neoadjuvant chemotherapy. Despite what I said about it's hard on patients, still about 30% of patients will have a complete response. So a really good local response after chemotherapy. So the thought process there is to consider bladder preservation. And there's been some limited studies that have explored this. And basically, the difficulty is trying to determine who those patients are. And we're maybe not so great just looking at doing scopes, cystoscopies, or doing CT scans. And some recent and ongoing prospective trials, some phase 2 trials, such as Retain Bladder, have investigated active surveillance after neoadjuvant chemotherapy. But I think the point is better. We need to use better biomarkers of whether or not there's been a complete response or not. And a lot of discussion around that with circulating tumor DNA or urine-derived tumor DNA as being biomarkers for treatment response and detection of any residual disease, as well as pelvic MRI. So I think there's a lot of conversation about that, and a number of phase 3 trials coming around the bend.
Exciting. Okay, thank you. It's great to hear the curated version of what happened in Paris. Thanks for sharing that. So AUA is coming up next week. We all know that. Lots going on. Do have to give a plug for 2 JU things, not necessarily related to bladder cancer, but we will have a JU European Urology co-led writing instructional course. So I encourage all of you to check that out. Also, we'll have a reviewer rodeo, keeping in line with the San Antonio theme. So definitely encourage, that's free to attend, and encourage any participants tonight to join us there. But what are you looking forward to most, Dr. Siemens, about AUA from a bladder cancer perspective? Is there anything on the schedule that you're like, that's going to be really interesting? I don't want to miss that. I know you have some things that you will be leading when you're there. Just would love to get an insider view on what you're looking forward to most at AUA from a bladder cancer perspective.
Yeah, that's a good question. I think one of the things we're talking about a fair amount, of course, from the Journal of Urology point of view, or the new AUA SUO guidelines in bladder cancer was just published last month. And a bunch of updates were made on statements around variant histology and urine biomarkers in particular. And a few things caught my eye, including a statement now suggesting the benefit of use of biomarkers to assess response to intravesical BCG. And to adjudicate equivocal atypical cytologies, which is extraordinarily common for us in clinical practice. So there was a really good discussion in the guidelines. So I think what I'm looking forward to is more of a conversation about how these urinary biomarkers are going to affect practice. At the EAU, there was several papers looking at things like this. Specifically, there was one again from Japan looking at artificial intelligence and how it can enhance cytology, similar to VisioCyte, I think. But again, there was a lot of conversation about that. And there was a Danish study as well, looking at the practical implications of using these urinary biomarkers in terms of, from a patient-centered point of view, can we reduce the number of cystoscopies? And we do a lot of cystoscopies in surveillance. And I believe in North America, the STRATA study will read out soon, also as a randomized study looking at the very pragmatic role of biomarkers like CX bladder to inform our decisions around whether or not to cysto or not for lower risk patients with microscopic hematuria. So I'm looking forward to a number of these upcoming studies and discussions around biomarkers. And I think at the AUA, and I think we're going to keep your eyes out for these discussions, because we've been through all of this before. We've had lots of good potential biomarkers validated analytically with well-defined sensitivity and specificity. But in the past, they really haven't been taken up by by clinicians. And there's lots of reasons for that, but partly I think because the tests weren't necessarily developed to help really inform us in terms of our decisions with our patients. So a lot of these newer biomarkers have been performed with a really good negative predictive value. So when the test is negative, you can be quite sure there's no cancer there in the bladder. So, which is a really well-known problem with what we use right now is cytology. So for us, our next steps are really to not just analytically validate it, but validate them clinically. And I think those are the sort of things that we're going to see at the AUA, and lots of conversations about how to incorporate these biomarkers into our practice.
Exciting. So we're here to my last question for you. You've had a really remarkable career and have, many years before you in that career. Would love to know what you think is the biggest potential in the future. What's on the horizon that you think we should know about, that patients would be interested in hearing about from our flagship journal's editor, and also, those who are practicing in the bladder cancer field.
Yeah, another good question. I think I would probably point towards the sort of hot topic in non-muscle invasive bladder cancer, and that's exploring. So BCG is our sort of gold standard immunotherapy drug for high risk non-muscle invasive bladder cancer. But what I've seen in the journal and in lots of other conversations outside of the journal at our meetings, the hot topic is really around other options other than BCG. We know that BCG works, but it doesn't work for everybody. And so the question is, are there other alternatives? So I think that one of the things we've been seeing is the use of innovative intravesical chemotherapy regimens, both for low risk, but also for high risk non-muscle invasive bladder cancer. So the Atlas trial read out over the last few months and was recently published in the Journal of Urology. And that's using a reverse thermal gel of mitomycin prior to a resection for bladder cancer, sort of in a therapeutic, but also as a neoadjuvant. Basically, can you avoid a turbot or reduce the number of trips to the operating room for low risk disease? And there was some really interesting data there, and more trials are planned. So that's interesting. But also, I think the big thing that many of us are waiting for is Max Cates will soon be publishing his phase 2 trial of gemcitabine docetaxel in BCG naive, higher risk non-muscle invasive bladder cancer. And from all reports, it looks like some great early CR rates, complete response rates, and we're eagerly awaiting the bridge trial that randomizes gemdosi to BCG. And yeah, everybody's really looking forward to those data to maybe increase our armamentarium for patients with high risk non-muscle invasive bladder cancer.
That's exciting. And it wouldn't be an interview with Dr. Siemens if I didn't give one more surprise question. And it's related to AUA, but not to bladder cancer. Would love to know if you could just give us a little peek into the JU lecture and also any highlights from our Pathway to Publication program, where we invite abstract authors to write a more fully developed full-length research article that then publishes simultaneously at the time of the meeting. So can you give us any sneak peeks into either of those areas?
Yeah, that's a really exciting program that we put together. This is the second year. So the first year was in Chicago, where we have asked the authors of the abstracts presenting at the UA to bring us their full paper so that we can simultaneously publish the full paper at the same time that the presentation is at the AUA, again, to increase the buzz and the discussion. And the uptake has been incredible. At 12 to 13 papers from last year in Chicago, including a number of state-of-the-art lectures where we've asked the presenters to write a JU forum for us, really to expand on some of the concepts that they're talking about. We have a number of them this year as well. I think one of them that's really quite interesting is on the UTI vaccine. Chris Doiron from our center is going to be doing a state-of-the-art lecture, and he's written out a JU form for us, and really interesting data and where this is going to go. A number also, keep your eyes open for some urinary biomarker work that we're excited to hopefully publish at the same time next month.
Great. Well, thank you so much for your time this evening. Really appreciate that. And also, I just want to remind everyone watching and share with your friends, come meet Dr. Siemens in person on Saturday, May 4th, 10 a.m. at the publications booth in the square in San Antonio at AUA 2024. Really excited to see what the future holds for bladder cancer. And thanks for all of your hard work on the journal and for making patients' lives better globally. Very much appreciate your time. Thank you.
Thanks, Jennifer. This was fun.